Hello everyone. Hello my dear students. Am I audible and visible? Hello students. Hello students. So welcome to Forensic Medicine and Toxicology Part 2. Hello students. Am I audible? Am I audible my dear students? Hello. Yes. Gosul Ajam. Gosul Ajam. Yes. My dear students, shall I start? Am I audible and visible properly? Am I audible and visible properly? My dear students, Gosul Ajam. Yes, yesterday we discussed about the last question, that was about the blood stain. So we discussed about benzidine test, phenolphthalein test, luminol test, orthotolidine test, Takayama test, Teekman test, and spectroscopic examination. Now we are into the second part of the forensic medicine and toxicology. In that, the first question is about this. Lucid interval most commonly seen in. Okay, lucid interval is most commonly seen in. What do you mean by lucid interval? Lucid interval is a period of consciousness between the two periods of unconsciousness. Okay, the lucid interval is a period of consciousness between two periods of unconsciousness. So what happens in road traffic accident? Because of cerebral concussion, the person might enter into a state of unconsciousness. Later, he might regain consciousness. That period of consciousness is known as lucid interval. Okay, lucid interval. Lucid interval, it is classically seen in, whenever question asked, lucid interval classically seen in, your answer should be extradural hemorrhage. So answer for this question is B is the correct answer. So Shubham Sharma, yes, Mr. Akshay Purohit. Good evening, Akshay Purohit. Good evening, Gosul Ajam. Classical lucid interval is seen in extradural hemorrhage. But remember, lucid interval can be seen in subdural hemorrhage also. It can be seen in some cases of subdural hemorrhage also. So this can be asked in your exam. Okay. It is not seen in subarachnoid hemorrhage. It is not seen in intracerebral hemorrhage. It is seen in extradural hemorrhage according to standard textbook. So once again I'll repeat, lucid interval is a period of consciousness between the two periods of unconsciousness. This can be seen in extradural hemorrhage. It can be seen in insanity also. During lucid interval, the person can make valid will, okay, and discharging patient during lucid interval without informing the complications that can amount to medical negligence. Okay, so all this can be asked in your exam. So my dear student, what is the bleeding vessel in extradural hemorrhage? What is the bleeding vessel in extradural hemorrhage? Anyone? What is the bleeding vessel in extradural hemorrhage? That can be asked in your upcoming FMGE exam. So remember, my dear student, it is the middle meningeal artery that bleeds during extradural hemorrhage. Let me discuss some image-based questions. So you need to try. So what is this hemorrhage? Can you identify this hemorrhage? So this can be asked as a image-based question. Okay. So look at this. So this is the dura mater. So this is the dura mater, and this is above the dura mater. So what is this? Can I identify this? What is this? Can I identify this? Shubham Sharma, Gosul Ajam. Yes, so this is the EDH. So this can be asked in your exam. Okay, image based question, EDH. Okay, you are right. So Mr. Shubham Sharma, you are right. So here the hemorrhage present above the dura mater, this is extradural hemorrhage. The bleeding artery is middle meningeal artery, and most commonly it is unilateral. It is commonly associated with linear fracture of the skull. Now look at this. Look at this hemorrhage. What is this hemorrhage? Can you make out this? In this hemorrhage, the hemorrhage is below the dura mater. It is below the dura mater, above the arachnoid mater. So, and you can see the bilateral involvement. So, bilateral crosses suture line, and so what is this hemorrhage? Can I identify this? Can I identify, my dear students? So, this is SDH, subdural hemorrhage. Sub means below, that is below the dura mater, that is subdural hemorrhage. It is commonly seen in chronic alcoholics. It can be seen in punch drunk syndrome. It can be seen in shaken baby syndrome. So it can be seen in some cases of trauma also. The bleeding vessel in SDH. Can you guess? What is the bleeding vessel in SDH, my dear students? What is the bleeding vessel in SDH? That can be asked in your exam. Yes, the bleeding vessel in SDH, that is your answer should be bridging veins. Okay, bridging veins. Bridging veins is the correct answer. Okay, so this is the SDH. Very good. Now look at the one more image now. One more image. You can see there is an image. You can see the base of the brain. There is a collection of hematoma at the base of the brain. What is this? What is this? Anyone can you guess? So this is subarachnoid hemorrhage. Subarachnoid hemorrhage because of rupture of berry aneurysm. Berry aneurysm. So I am discussing intracranial hemorrhages. We discussed few points about EDH, then SDH, then we are discussing the ASCAH, that is subarachnoid hemorrhage below the arachnoid mater, that is because of rupture of the berry aneurysm. So that is the question very commonly asked in the exam. Okay, yes. Now look at this now. What is this hemorrhage? What is this hemorrhage which is visible in the screen? You can see here there is an involvement of the lobes of the brain. There is an intracerebral hemorrhage. So this is ICH, intracerebral hemorrhage, and the most common artery involved is middle cerebral artery, MCA, because of rupture of the Charcot-Bouchard aneurysm. So there are 4 types of intracranial hemorrhage that you must know during autopsy. One is extradural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage, intracerebral hemorrhage. The bleeding artery in EDH, middle meningeal artery. SDH, bridging veins. SAH, berry aneurysm rupture. ICH, intracerebral hemorrhage, that is the middle cerebral artery. The most common cause is hypertension. So this can be asked in your exam. Anything can be asked in your exam, that is as a image based question. That is the basic concept asked in forensic medicine from regional injuries. So my dear student, is it okay? Akshay Purohit, Shubham Sharma, Gosul Ajam. Yes, say yes. So shall I move on to the next topic? Next. Battle sign is seen in. Battle sign. So this is asked in your exam. Battle sign is seen in fracture of intracranial fossa, fracture of middle cranial fossa, ring fracture, fracture of posterior cranial fossa. What do you think? What do you think, my dear students? What do you think? Yes, 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 you are right. Very good. Shubham Sharma. So answer is correct. Fracture of middle cranial fossa. So what is battle sign? The battle sign is collection of blood behind the ear around the masthead process. So because of fracture of middle cranial fossa. You can see here. So this is the battle sign. And this is the battle sign. Battle sign. This is the feature of fracture of middle cranial fossa. It was first discovered, first explained by Dr. William Battle. He was an English surgeon who explained this in detail. That's why it is known as battle sign. But remember, there can be one more question can be asked in the exam. What do you mean by black eye? Fracture of intracranial fossa. Okay, the fracture of intracranial fossa, that leads to a condition known as black eye. Black eye, it is also known as raccoon eye. Raccoon eye. It is also known as spectacle hematoma. So the collection of blood around the eyes. So that is because of fracture of intracranial fossa known as battle sign. So remember, both this battle sign as well as the black eye, they are example for migratory bruise. Now the question can be asked in your exam. The example for migratory bruise, your answer should be battle sign as well as the black eye. So both are very commonly asked in your exam. So ring fracture we discussed. Ring fracture is seen in fall from height. So fracture of posterior cranial fossa, so that is not related to any of the question here. Yes, so answer is B is the correct answer for this question. Look at this. So this is what we discussed, black eye, also known as raccoon eye. And this is what we discussed here, battle sign, that is the bleeding around the masthead process from the posterior auricular artery. When it is associated with the ear bleeding, there can be high chances of fracture of base of the skull, that is middle cranial fossa. Okay, yes, so that is can be asked in your exam. Now, question number 17. All of you, my dear student, go through this question and try to answer. As per MTP Act, MTP can be done up to, MTP Act 2021, MTP can be done up to 12 weeks of gestation, 24 weeks of gestation, 20 weeks of gestation, 22 weeks of gestation. What do you think? What do you think? Can you try this? Can you try this, my dear students? Okay. Yes, yes, come on, come on. Come on, come on, try. Yes, oh yes, Gosul Ajam, you are right. So this is the answer for this question is, so that is 24 weeks of gestation. Okay. So 24 weeks in some condition. What are the conditions up to 24 weeks? One is the rape, when pregnancy caused by rape. Second, when pregnancy caused by incest, or when pregnancy caused in a disabled woman. So disabled woman. So all these are indication up to 24 weeks of gestation. So here are some questions, my dear student, this can be asked in the exam. Up to 12 weeks, how many doctors are needed for abortion? Up to 12 weeks of gestation, The number of doctors needed, it is one doctor. So that is one RMP. One RMP. One registered medical practitioner. So up to 12 weeks of gestation for MTP, that is medical termination of pregnancy, the advice of one RMP is sufficient. What about 13 to 20 weeks? What about 13 to 20 weeks? Yes, Gosulajam, 13 to 20 weeks. Gosulajam, incest means that is, marriage between or sexual intercourse between blood or marriage relatives, blood relatives. That is, intercourse between cousin marriages or sexual intercourse between the cousin. If that lead to pregnancy in the girl, that can be indication for the MTP up to 24 weeks. So up to 13 to 20 weeks, how many doctors' advice is needed? Remember, it's an update. Again, it is one RMP. One RMP. Then 20 to 24 weeks. What are the indication? Rape, incest, minor, disabled women. So 2 RMP required. So in this condition, the advice of the 2 RMP required. 2 doctors. So the advice required up to 24 weeks. Beyond 24 weeks. Beyond 24 weeks, so there can be one indication. So that is known as fetal abnormalities. When there is a serious fetal abnormalities, so that is the indication for MTP beyond 24 weeks. For that, approval from medical board is required. Medical board is required. Medical board is required. In emergency, remember MTP. So whenever there is an emergency, whenever there is a condition which endangers the mother's life, in that condition, any doctor can do abortion at any place according to MTP Act. Okay. And one more update, my dear students. So you need to keep the details of the patient 100% confidential. Need to keep all the details confidentially from the others. So breach in women's privacy. Breach in women's privacy, that is punishable offense. The punishment is 1 year of imprisonment. 1 year of imprisonment. Okay, so this can be asked in your exam. Yes. Now, my dear student, there is one more question asked in the exam. MTP Act, whether it is applicable to married female or unmarried female. So, recent update, MTP Act is applicable to both married as well as unmarried female. So, one of the commonest indication is the failure of contraceptives. Failure of contraceptives. Yes. Now, this question. Excessive sexual desire in man is called as. What do you think, my dear student? Next question. So, excessive sexual desire, also known as sex addiction, in a man known as. So, options are satyriasis, rigidity, voyeurism, nymphomania. What is the best answer? Yes, Payal Patel, Shubham Sharma, Gosul. Yes. So, sex addiction in males, that is impulse disorder, so that is known as satyriasis. What is the best answer? The best answer is satyriasis. Satyriasis is a impulse disorder that is characterized by irresistible impulse to have sexual intercourse, also known as sex addiction. So that is associated with personality disorders. That is also associated with paraphilias. In females, it is known as nymphomania. So in females, it is known as nymphomania. The question can be asked. So nymphomania, what is nymphomania? That is excessive sexual desire in females. What is frigidity? The frigidity means, what is frigidity? What do you mean by frigidity? Payal Patel, Gosulajam, anyone? What do you mean by frigidity? Frigidity means it is impotency in female, or we can say emotional coldness in female, or sexual coldness in female. So, when a female is having difficulty or inability to initiate the sexual act, that is known as frigidity. Frigid female, that is sexual coldness in female. What is voyeurism? The voyeurism is nothing but peeping tom. Peeping tom, that is sexual paraphilia characterized by observing people while changing dress. Especially it is common in males. So voyeurism is also known as peeping tom. Peeping tom. Voyeurism is punishable under. This can be asked. Voyeurism is punishable under. Voyeurism is punishable under 354C. 354C IPC. So this can be asked in the exam. So satyriasis, nymphomania, frigidity, voyeurism, all four are very commonly asked in the exam. You need to memorize all the four. Voyeurism is also known as peeping tom, that is punishable under 354C Indian Penal Code. Next, look at this question number 19. A doctor, this is very interesting question. Doctor sends patient to diagnostic center of MRI. The next day, representative visits the doctor with a letter and the money. Prove about this act is. What is the best answer? So here, doctor is taking commission or giving commission. Giving commission, taking commission. In medical practice, that is known as dichotomy. What is the answer for this question? Answer for this question is dichotomy, also known as fee splitting. Fee splitting. Fee splitting. Okay. Association of doctor, that is not the answer. What do you mean by covering? What do you mean by covering? Anyone can you guess? What do you mean by covering? So in medical ethics, what do you mean by covering? Can you guess? What do you mean by covering? What do you mean by covering? Yes, anyone? Anyone can you answer? Anyone? What do you mean by covering? The covering means association with unqualified person. Association with unqualified person during medical practice or allowing some unqualified person to your OT or to your clinic during examination, that is known as covering. That can be asked in your exam. So yes, my dear student, so I remember whenever I teach this, I remember one very commonly asked topic, that is infamous conduct. Infamous conduct is very commonly asked in your exam. What is infamous conduct? Whenever I teach infamous conduct, I remember one very famous movie that is related to infamous conduct. That is dishonorable, disgraceful conduct of a doctor in medical practice. So Arjun Reddy, have you seen that movie Arjun Reddy? Yes, yes, my dear student, infamous conduct is a dishonorable, disgraceful conduct of a doctor. So what do you mean by infamous conduct? That can be remembered with the help of mnemonic 6 A's. 6 A's. What are 6 A's? Infamous conduct. 1A, association with unqualified persons. That is known as covering. Discussed already. That is known as covering. Covering. Dichotomy we discussed. That is fee splitting, taking commission or giving commission in medical practice. That is okay. Next, advertisement. when doctor is doing some irrational advertisement, you know, some advertisement using some large flex, so are printing his photo in that flex. All this, that is advertisement, irrational, excessive advertisement by a doctor, that can be punishable under infamous conduct. Okay, next. Adultery. When doctor is involved sexual activity with the patient, that is adultery in infamous conduct. So that is punishable by state medical council. State medical council. One more A, that is abortion, that is illegal abortion. Criminal abortion, when doctor is involved in criminal abortion, illegal abortion, so it is also punishable under infamous conduct without any indication. Addiction, so treating patient under the influence of heroin, under the influence of ganja, hookah, alcohol, all this comes under infamous conduct. Alcohol, so all these are punishable. So actually they are punishable under the medical ethics, so by state medical council. Remember, state medical council, SMC. So this can be asked in your FMGE exam. So infamous conduct is defined and the punishment is given by state medical council. Example, doctor is doing all this infamous conduct in Karnataka state medical council. So like that it is. State medical council, either they may issue warning, or they can do something known as professional death sentence. So my dear student, what do you mean by professional death sentence? Anyone, can you guess? Yes, what is professional death sentence? Yes, professional death sentence. Can you answer? Anyone? Charlotte, Harshal Jain, Gosal Ajam, Payal Patel. Yes, SMC can issue warning notice or professional death sentence. PDS. This PDS, professional death sentence. That is removal of name of the doctor from the medical register is known as professional death sentence. Once again, I'll repeat, infamous conduct is very commonly asked in the exam. So that is dishonorable, disgraceful conduct of a doctor that can be remembered with the help of mnemonic 6 A's: association, advertisement, adultery, abortion, addiction, alcohol. It is punishable and the punishment given by state medical council. What are the punishment? Either it is warning or it is professional death sentence. Okay, so yes. Okay, now question number 20. Yes, you are right, Nagathan, you are right. So that is disqualifying doctor from the profession. That is a cancellation of license of the doctor is known as professional death sentence. Any doubt in this, you can ask me. So this is more than sufficient for your FMGE exam. All these are very commonly asked. Question can be asked about the covering also. Covering, dichotomy, all this. Okay, yes. Here I'll discuss one more question here. Medical negligence. So medical negligence, that can be asked in your exam. Medical negligence. Especially medical negligence can be two types. So it can be civil negligence, it can be criminal negligence. It can be civil, so it can be criminal negligence. So question asked in FMGE exam, criminal negligence is punishable under dash IPC. Anyone, can you guess? Criminal negligence, when doctor is involved in criminal negligence, that is, rash behavior, a rash act of the doctor leading to death of the patient. Okay, that is known as criminal negligence. That is known as gross negligence. So doing surgery on wrong patient, wrong side, all these are example for the criminal negligence. My question is, criminal negligence is punishable under dash IPC. Anyone, can you guess? Anyone? Anyone? Yes, this can be asked in the FMG exam. Criminal negligence, gross negligence by doctor is punishable under dash IPC. Anyone, can you guess? Anyone? Not 84, not Mohammed Rahman, it's not 84. 84 is McNaughton's rule, criminal responsibility of insane person. No, it is not 84. Yes, come on, try. So that is 304A. So 304A IPC, correct answer. You can remember A for apron. A for apron, that is 304A. So 304A, correct answer. How to remember? Apron, doctor, apron. So it is 304A. 304B, that is also asked. Anyone, can you guess what is 304B IPC? 304B IPC. So 304B IPC, remember B for BV, wife. What is that? What is that? Gosumajam. Anyone? What is that? 304B. 304B. B for BV. So death of the wife within 7 years of marriage. That is known as dowry death. So this can be asked in your exam. Dowry death it is. So this can be asked in your exam. Fine. Good. You are right. CGC, you are right. Dowry death. Now this is very interesting question. You can see some very nice animation there in the picture, the slide. What you can see here, after 72 hours of cessation of alcohol, the person is chronic alcoholic, and after 72 hours of cessation of alcohol, which of the following withdrawal symptom can be seen in alcoholic patient? So this question asked in FMGE 2021. So seizures, yes, seizures can be seen. Tremors also can be seen. Hallucination also can be seen. Delirium tremens also can be seen. The best answer, your answer should be 72 hours, that is around 3 days. Your answer should be, that is the B is the correct answer. Delirium tremens. The delirium tremens, that is also known as a DT. So that is the alcohol withdrawal syndrome. The symptoms and signs, they start between 2 days to 3 days, 48 hours to 72 hours after the cessation of alcohol. So answer for this question is B, better than the seizures. Tremor also can be seen in delirium tremens. Hallucination also can be seen in delirium tremens. The best answer is B is correct answer. Okay, next. So alcohol withdrawal syndrome, that can be remembered with the help of mnemonic HITS. What is the mnemonic? HITS. HIT, remember, hit by cessation of alcohol. HITS is a mnemonic. What is H for? H for hallucination. H for hallucination. What do you mean by hallucination? Hallucination is a disorder of perception. So it can be visual hallucination, it can be tactile hallucination. Okay. And I for increase vital signs and insomnia. Increase vital signs, increase BP, increase heart rate, increase respirator rate. Insomnia is also seen in case of delirium tremens as well as alcohol withdrawal syndrome. Tremens, T for tremors, one of the commonest finding in case of delirium tremens. Shakes, S for shakes, sweating, seizure, stomach pain, nausea, vomiting, all these are the features of alcohol withdrawal syndrome. The mnemonic is HITS is the correct answer. Yes. So that's about the this question. Now there's one more question asked in recent exam. I remember. What is Wernicke encephalopathy? Anybody? What is Wernicke encephalopathy? What is Wernicke encephalopathy? Yes, come on. Wernicke encephalopathy. So Wernicke encephalopathy, that is because of chronic consumption of alcohol. So chronic consumption of alcohol, so there can be deficiency of vitamin B1. Vitamin B1. So vitamin B1, that is also known as thiamine. That is a very important vitamin that is for the synthesis of myelin sheath in the brain. So that causes some disorders related to myelination. So the clinical features can be remembered with the help of mnemonic known as GOVA. This is the old mnemonic. I remember like this. GOVA is a mnemonic. And remember alcohol, GOVA. Alcohol, GOVA. What is G for? G for global confusion. G for global confusion. Global confusion. O for ophthalmoplegia. Ophthalmoplegia. And A for ataxia. This is asked in recent NEET PG exam also. Wernicke encephalopathy was question asked in recent NEET PG exam. So Wernicke encephalopathy, GOVA is the mnemonic. There is something known as Korsakoff psychosis. That is also very commonly asked. That is characterized by filling memories, confabulation. There is also one question about Marchia-Fava-Bignami syndrome. So alcoholic hallucinations. All this can be asked. So please try to remember and memorize all this. Okay. Next. Now look at this. Question number 21. A dead body is recovered from the crime scene. A dead body was recovered from the crime scene. Prove about this condition. So you can see here multiple ligature mark. You can see the multiple ligature mark. Multiple ligature mark. Multiple ligature mark are there. So around the neck, multiple ligature mark are there, and multiple knots also there. So multiple knots are there, multiple ligature circles are there, and face is congested. You can see the face that is congested. Congested here. So face is congested and multiple ligature materials are there, multiple knots are there. What do you think? So this must be a case of homicide. So, but here the question is about this. This is the finding here. You can say like this. What is this known as? So this is known as cadaveric spasm. Okay. So answer can be D also. Answer can be cadaveric spasm also. Definitely not suicide. Definitely not rigor mortis. It is not rigor mortis. Rigor mortis is a postmortem change, shortening and stiffening of the muscle and joint that involves all the muscles and joint. So here the answer is cadaveric spasm. So cadaveric spasm, it is a spasm of particular muscle, especially the muscles of the forearm or muscles of the limb. So that is an antemortem phenomena. Okay. So answer is B is the correct answer. B is the correct answer. Yesterday we discussed about the cadaveric spasm. Cadaveric spasm is also known as cataleptic rigidity. Cadaveric spasm is also known as cataleptic rigidity. So my dear student, what about this cadaveric spasm? Is it antemortem or is it postmortem? Is it antemortem or is it postmortem? Antemortem means before death, or it is postmortem after death, or it is both. Anyone can you guess? Hiranna, Hirannasi, Nagatan, Hiranna beta, Gosul Ajam, Mohammad Rahman. Yes, come on. What do you think? What do you mean? What is this? Cadaveric spasm. Cadaveric spasm, remember, it is a well-known fact. It is an antemortem phenomena. This can be asked in the exam. Very good. Antemortem phenomena. So cadaveric spasm, so it is also known as alkaline rigor. It is a purely antemortem phenomena. It is not a postmortem phenomena. Rigor mortis is a postmortem phenomena. Cadaveric spasm is an antemortem phenomena. Heat stiffening, that can be antemortem or postmortem. Cold stiffening, antemortem, postmortem. So the cadaveric spasm is purely 100% antemortem it is. Fine, good answer. Next look at this. Question number 22. Following is a finding noted during autopsy of elderly male. So during autopsy room, while opening the pericardium, so the pericardium containing large amount of the blood. So heart. So the heart, around the heart, there is a large amount of the blood. What is this known as? What is this known as? Yes, this is a very, very simple question, all of you. So this is how the blood is there around the heart. So the heart is unable to contract because of the blood around, because of the pericardial effusion or pericardial collection of the blood. So this is the classical case of, what is this? Acute cardiac tamponade. The correct answer is acute cardiac tamponade. My dear student, what is the most common cause? What is the most common cause for acute cardiac tamponade? What do you think? Mohammed Rahman, Gosul Ajam, Iranna. So yes, come on. What is the most common cause? Elderly male. Elderly male presents to you with a history of, or with the signs and symptoms of cardiac tamponade on ECG. What do you think? So it must be a case of acute MI. It can be cardiac rupture. Okay. So one of the cause is the MI, myocardial infarction, or it can be trauma, or any operative procedure. So that is also possible in cardiac tamponade. So this is the cardiac tamponade, and this is the antemortem clot. You can see here, this is the antemortem clot. Antemortem clot. Yes, chest trauma. Look at this. Here is a case of trauma that is leading to pericardial effusion, that is known as the cardiac tamponade. So this is the case of road traffic accident. Okay. So this is the case of some road traffic accident. So RTA, and you can see the perforation over the heart. The perforation over the heart. You see the small perforation over the left ventricle. And during autopsy, what I got, the finding which I got is the blood clots, large blood clots around the heart. So this must be a case of trauma induced acute cardiac tamponade. And you can see here, so this is the cardiac rupture. This is the cardiac rupture of left ventricle. So here the person met with a road traffic accident, some blunt force trauma over the chest, and a blunt force trauma that was causing damage to the left ventricle or over the heart. So there was a rupture of the heart, and because of that there was a cardiac tamponade and death. So this is how the patient presents in forensic medicine and toxicology, a classical case of acute cardiac tamponade. Yeah, next. Look at this. Now question number 23. Identify the following plant. So there is a plant which is given here. Yes, plant is given here. And so yellow color flower. The flower is yellow flower. Yellow flowers which are there in the plant. So options are Datura plant. Can it be Datura plant? No. Datura, you will get the spiny projections, also known as thorn apple. Aconite, no. Okay, aconite doesn't look like this aconite. It's a cardiac poison. Calotropis, no. Answer should be yellow oleander. So yellow oleander, it is a cardiac poison that is nothing but Cerebera thievetia. Cerebera thievetia is yellow oleander. There is something known as white oleander also known as pink oleander, that is nothing but Nerium odorum. So this is yellow oleander. Cerebera thievetia. Cerebera thievetia. So it contains some active principle, thioetin, thiotoxin, and others. So it causes cardiac arrhythmias and MI, or it can lead to first degree heart block, second degree heart block, and death. Look at this. So this is how aconite plant looks. It is also known as blue devil, blue helmet. This is the aconite plant, and this is the aconite root. Okay, so the question can be asked, what are the cardiac poisons? Cardiac poison is aconite, digitalis, yellow oleander, white oleander, So all these are cardiac, even tobacco, that is also cardiac poison. Okay, nicotine is also cardiac poison. So this is aconite root. Okay, aconite root and aconite plant. And remember, this is sweet in taste. This is sweet in taste. Sweet in taste. It's sweet in taste, so it can be mixed with the pan. It can be mixed with some sweet items. So that's why it is one of the ideal homicidal agent. It is known as the queen of all poison. Queen of all poisons. Queen of all poisons. Anybody? Which is known as king of all poison? Which is known as king of all poison? King of all poison. Can you guess, my dear student? Which is known as king of all poisons? Yes, let's see who is going to answer. Irana, Mohammad Rahman, Irana, Ghusul Ajam. Yes, yes, come on, anyone? Ghusul Ajam. Yes. What is the answer? King of all poison. King of all poison. Which is king of all poison? The king of all poison is arsenic. The queen of all poison, that is the aconite. Both are ideal homicidal. So that can lead to some serious complications and death of the person. So, and this aconite root is confused with the horseradish root. Aconite root that can lead to a condition known as hippus. Hippus is alternate constriction and dilation of the pupil, that can be asked in your upcoming. Next, look at this plant. What is this plant? Yes, common. So yes, this plant. You can see a plant here, and which is used in case of abortion. It is used in abortion. I'm giving you clue. It is used in abortion, which causes uterine contraction and death of the fetus. It is also used in artificial bruise. It is also used in infanticide. Infanticide. What is this organic irritant? The plant which is there here. This can be asked in the exam. So yes, good answer. So the answer for this question is calotropis. Calotropis. The calotropis can be two types. Calotropis procera. Calotropis procera. Calotropis gigatin. It can be two types. What is the active principle? Calotropin, calatoxin, gigatin. So which is used in artificial bruise. It is also used in abortion. So procera has a white color flower. Gigatin has a purple color flower. Okay, so that can be asked in your exam. Look at this plant. Anyone can identify what is this plant? A and B. A and B. Can you make out what is this A and B plant here? This can be asked as a image based question in your FMGE exam. My dear student, concentrate. What is this image? What is this image? Come on. You can see the single fruit spiny projection, multiple fruit spiny projection. What is the best answer? So best answer. So this answer, the answer for this question is, now let's see who is going to answer. Let's see who is going to answer this. The first one, that is nothing but datura fruit. This is the thorn apple. Thorn apple. And this is your resin plant. Ricinus communis. Ricinus communis, also known as castor plant. Castor seed, which is an organic irritant. So that is used in case of murder, especially highly planned, sophisticated murder. One very famous case is umbrella murder case. It's organic irritant. So in exam, thorn apple, single, that is the datura fruit. Multiple are there, clusters are there, that is nothing but C for clusters, C for the, that is nothing but your castor plant. Castor plant. Now, this is a very simple question. Yesterday we discussed. Patient has been come to casualty with unknown poisoning. Patient has excessive salivation, constricted pupil, diarrhea, hypotension. which of the following is used for treatment? So this is the classical case of OP poison. Again, the same question repeated in FMGE 20, 21, 20 also. So answer for this question is atropine, correct. Atropine, correct answer. Physostigmine, no. Neostigmine, no. Naloxone, no. You can give diacetylmonoxime or prolidoxime also. So that is given after atropine. Active principle of this poison. This is also yesterday we discussed in detail about the datura poison. So datura, this is the datura fruit. You can see the spiny projections here. Spiny projections. So this is the spiny projections are there. And you can see the seeds. You can see the seeds. What they contain? What they contain, my dear student? What datura contain? Yesterday we discussed, no? Datura. Datura contain hyoscine, hyoscyamine, traces of atropine. Answer is hyoscine, correct answer. Not quinine, not thebaine. It is the hyoscine, correct answer. Next. Again, yesterday's topic question. A test was performed for a sample which following yellow needle crystals. Yellow needle shaped crystals are. So whenever question asked yellow needle shaped crystals, and again, my dear student, I am just telling you, blood stain and seminal stain, they are asking every year. So this you must know. So this is whenever you see yellow needle shaped crystals like this, so this must be a case of Barberio test. Answer for this question is semen is the correct answer. Very good. Many they got the answer. Semen is the correct answer. A man in the airport got fainted and unconscious. Fainted unconscious probably because of intracerebral hemorrhage. His bag contained enema apparatus. He is having enema apparatus. So and also laxatives to induce diarrhea. X-ray abdomen shows small packs of drugs. You can see the small packs of drugs everywhere. So the colon and all that contains small packet. So this contain. So this must be a case of body packer syndrome. So body packer syndrome. So false about this. Abdominal scan is indicated. Yes, that is a true statement. He is malingering. No, it is a false statement. He is at risk of poisoning. That is a true statement. Case of body packer syndrome, yes. So criminal, they transport the cocaine, heroin and all from one country to other country by keeping cocaine and heroin in the plastic material, and they'll consume it, and they induce diarrhea by laxatives or by enema. They'll remove the heroin or the cocaine from their body. Sometimes what happens? So one of the packet that opens inside the abdomen, so that releases cocaine or heroin that enters into systemic circulation, causes serious complications, and that is a case of body packer syndrome. Next, the answer for this question is B is the correct answer. Next, a person was found dead. Person was found dead in unnatural condition. Postmortem shows nail scratches in the face. Some nail scratches are there. You can see here some nail scratches here, there. Nail scratches are there. Lip laceration in the inner side of the lip. So inner side of the lip, there is a laceration. So there is a laceration. Hypostasis is fixed. Which of the following cannot be the reason? So what is the finding here? Some nail scratches are there. Laceration over the inner lip is there. Is it a homicide? All of you, what do you think? What do you think? What type of murder is this? What is the mode of death here? It's a homicide. It's a manner of death. My question is, what type of death it is? Suffocation or drowning, or is it a case of hanging, or is it a case of throttling? What do you think, all of you? What do you think? Can you answer this? What do you think? Whenever you see this type of question, you need to know the what is the probable asphyxial death here. Yes, come on, guess, my dear student. The only finding is a lip laceration, and also some scratches are there over the face, nose, and in nostrils. So it must be a case of smothering. So this is a case of smothering. 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 Okay, it is a case of suffocation. It is a type of suffocation. Smothering. The smothering means the closure of the nostril and the mouth by using some pillow or some material. That is known as smothering. So smothering, the cause of death is again asphyxia. Asphyxia is the cause of death in case of smothering also. Yes, it is a true statement. Homicide, yes. Postmortem can be done within 24 hours. Cause was throttling, that is wrong. This is wrong. Okay, throttling. It is not throttling. Beta, this is throttling. Okay, so this is smothering and this is throttling. So it is not throttling. It is a must be a case of smothering. So answer for this question is, that is cause was throttling given, that is wrong. Let's see what is throttling and what are the findings. Okay, let's see now. Let's see, my dear student, look at this image and you can see there is an animation showing throttling. What is the finding that is there in case of throttling? Anyone, can you guess? Anyone, what is the finding you will see in case of post-mortem of a case of throttling? Yes, come on, come on, come on, Muhammad Rahman. What is the finding here? What is the post-mortem or autopsy finding? Yes, 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 come on. Yes, one very important finding that is seen here. So that is known as six-penny bruise. Okay, six-penny bruise. Six-penny bruise. So because of the pressure by the fingers of the assailant, so the pressure over the neck, that can cause some bruises around the neck. So that is known as six-penny bruise. That is asked in your FMGE exam. Second thing, so there can be bleeding. There can be bleeding from the nose, bleeding from the mouth. That is very common. Extravasation of blood in the neck tissue, that is very common. Face is congested. Laceration of the muscles, the muscle tendon, and also there can be fracture of hyoid bone. The hyoid bone, there can be fracture. Hyoid bone, there can be fracture. And the fracture in case of a throttling, that is inward compression fracture. Okay, so that is asked in your exam. Inward compression fracture. Inward compression fracture, that is seen in case of throttling. Outward compression fracture, that is seen in case of hanging. Both are FMGE questions. Inward compression fracture. Inward compression fracture, that is throttling. Outward compression fracture, that is seen in case of hanging, as well as ligature strangulation, that can be asked in your exam. What is the cause of death? The cause of death is asphyxia, that is the combination of hypoxia and hypercapnia. Next. A gunshot bullet showing tattooing, inverted margin, no signs of bone, and the charring. The range is. Can you try this? So patient is having tattooing here. The patient is having tattooing. Why tattooing is caused? Tattooing is caused by unburnt gunpowder. So tattooing is caused by unburnt gunpowder. Unburnt gunpowder. So whenever you see tattooing, whenever you see inverted margin, abrasion collar, grease collar, and tattooing, so your answer should be near shot. The correct answer for this question is near shot. So near shot is the correct answer. The answer for this question is near shot. Okay, near shot is the correct answer. Let's see, there are four ranges. Okay, there are four ranges of injuries that can be caused by revolver and automatic pistol. They are known as entry wounds, right? So look at this. You can see here a case of entry wound. So this is the entry wound, and you can see the stellate margins. You can see the stellate or star shaped entry wound. So my dear student, whenever you see inverted margin, star-shaped, stellate-shaped entry wound. What is the range? What is the range, all of you? What is the range? What is this range? What is this range? Yes, so this must be contact shot. What is this? Contact shot. What is the finding in contact shot? You will see stellate entry wound. And sometime in some cases you will get muzzle imprint. Muzzle imprint. The burning, blackening, tattooing, all these are absent, or they are very, very minimal in contact shot. They are present inside the track of the entry wound. So that is about the contact shot. So the contact shot, you will see the stellate shaped entry wound and muzzle imprint. The second one, look at this, is the blackening. Second one is the close shot. Second one is the close shot. In close shot, my dear students, you will see blackening. How blackening is caused? The blackening is caused by burnt gunpowder because of the smoke particle. So whenever you see the blackening, it must be a case of close shot. So close shot, what is the finding? Blackening. Blackening is seen. And the third one is the near shot. Near shot. What is the finding in near shot? In case of near shot, you will see the tattooing. You will see the tattooing. What do you mean by tattooing? Superficial entry wounds seen around the entry wound. So they are caused by unburnt gunpowder. The last one is the distant shot. This is the distant shot. Distant shot. Distant shot, you will see only the entry wound. There is no blackening, there is no burning, there is no tattooing. So only inverted margin, abrasion color, grease color that is present. That is the standard distant shot. So there are 4 types of shot. What are they? Contact shot, close shot, near shot, distant shot. In FMGE exam, stellate shaped entry wound, contact shot. Blackening, close shot. Tattooing, near shot. And remember, most of the entry wounds, they have inverted margin. They are smaller in size. Smaller in size. This can be asked in your exam. So my dear student, what is the cause of death in case of firearm injury? What is the cause of death? Anyone can answer? What is the cause of death in case of firearm injury? What is the cause of death? Yes, my dear student. Yes, Iranna beta, Iranna, Muhammad Rahman, Gosul Ajam. What is the cause of death in case of firearm injury? Yes, your answer should be shock and hemorrhage. Shock and hemorrhage is the cause of death in case of firearm injury. Next. A cricket player, question number 30. Question number 30. A cricket player was hit in the head, becomes unconscious. After some time, he became conscious. So this is the classical case of lucid interval. After the match, he lost his consciousness, was taken into hospital. The diagnosis could be. So today's topic we discussed today is the case of extradural hemorrhage. Not subdural, not subarachnoid, not intracerebral hemorrhage. This is the classical lucid interval. Classical lucid interval is seen in extradural hemorrhage. Which of the following is best to find out sex in a 12-year-old child? So the question is about identification. Identification. So which of the following is best in a child? Question is about 12-year-old child. 12-year-old child. So the answer should be hip is the correct answer. The accuracy of hip is around 95%. 95%. Skull is around 90%. Femur around 80%. Mandible is also around 80 to 90%. The best answer is the hip is the correct. Yes, Abdullah Abdul Wasim, you are right. So answer for this question is the hip. That is the correct answer. Especially in hip, sciatic knots is very important. Okay, sciatic knot. Sciatic notch. So sciatic notch is a very important finding in case of male and in case of female. How it looks? Sciatic notch. Anyone can try? How sciatic notch in case of yes, 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 yes. Come on, come on. Yes, hip bone is the correct answer. So sciatic notch in male, sciatic notch in case of male, it is deep and narrow. Deep and narrow. In female, it is broad and shallow. Broad and shallow. This can be asked in our exam, my dear student. Sciatic notch in case of female, broad होगा और shallow होगा. It is not deep. Sciatic notch in males, ये होगा deep होगा, but narrow opening होगा. So that is the finding. Very important in identification of male or female pelvis, especially in children. One more point that can be asked in an exam is the subpubic angle. Okay? Subpubic angle. Remember, subpubic angle that is acute in males around 75 to 90. In females, it's around 90 to 110. That can be asked in our exam. One more, ischial tuberosity. Ischial tuberosity is averted in case of female. One more is that is obturator foramen. Obturator foramen in female that is triangular. There is also presence of pre-auricular cell. Okay, in case of female. Now let's discuss about this video. All of you, there is a video I am showing you here. There are two bones are there, A and B, and look at the sciatic notch A and B. Identify which is male and which is female. If it is deep and narrow, then it must be male. Shallow and broad, it must be female. What is A and B? Can you try this? Can you try this, my dear students? Yes, yes, come on, come on, come on, come on, come on, yes. Yes, come on. I'll give you some 30-second time. Just watch this video, small video, and also there is a finding he's showing pre-auricular sulcus. So this is pre-auricular sulcus. I think you hope you got. So this is the auricle and this is the pre-auricular sulcus. So what is this? A and B? Yes, try. Come on, come on. Pre-auricular sulcus can be asked in the exam. Yes, what is your final answer? The final answer, what you can see here, in A, the sciatic notch is shallow and broad. So this must be female. This must be female and this must be male. This must be male. And also you can look for pre-auricular sulcus. Pre-auricular sulcus that is visible here. So pre-auricular sulcus, I'll show you the pre-auricular sulcus. So this is pre-auricular sulcus. What you can see here, this is the pre-auricular sulcus. So pre-auricular sulcus, that is because of attachment of the sacral ligaments, that is prominent after childbirth, because of the attachment of the anterior sacral or McEnroth's ligament. So this is classical pre-auricular sulcus. Yes, my dear students, you are right. A is female, B is male. Right. Hope you understood this. Okay. Yes, come on. Understood now? My dear student, have you understood? Is it okay, my dear students? Reply me. Saurabh Nikham, Gosul Ajam, Abdul Rahman, Mohammad Rahman. Yes. Okay. Next. Look at this. Now this is, I think you can answer. Already we discussed it today. Punishment of causing death due to medical negligence is given by. What is the best answer? What is the best answer for this question? Punishment for causing death due to medical negligence. So that is 304A correct answer. 304A. What is the punishment in 304A? So what is the punishment? Remember, answer is 2. Winner sign, hai na? So here doctor is not winner, loser here. 2 years of imprisonment. So criminal negligence, the punishment is 2 years of imprisonment, and it is comes under 304A. So 304B, dowry death. Dowry death. So it is not demand draft, dowry death. That is in case of 304B. 302. What is 302? Murder. 302 is murder. Punishment for murder. Okay. So in any case of murder, punishment is 302, that is life imprisonment or death sentence. Like example, Nirbhaya rape and murder. So it was punishable under 302 also, 376A also. 338. So 338, negligence leading to grievous hurt. Okay. Negligent act leading to grievous hurt, that comes under 338 IPC. 338 IPC. So that is so. Now this is the very nice question, my dear student. This is a very nice question asked in FMGE. A woman pretend to be pregnant. So she pretends that she is pregnant and presenting a child, appealing that neighbor as a father. Neighbor is the father, or some male is the father, just to having a motive that to acquire his property. The motive is there, so he must be very rich. The male must be very rich, a neighbor must be very rich. So what is this known as? Anyone? Anyone can you guess? Anyone can you guess what it is? What it is? Can you guess? Yes, come on. Can it be superfetation, posthumous child, supposititious child, superfecundation? What is the answer? What is the answer for this question? What is the answer for this question? Yes, come on. Yeah. So this is supposititious child. The correct answer is fictitious child, supposititious child. Fictitious child, also known as supposititious child. The correct answer is C is the correct answer. C is the correct answer. Okay, superfecundation is okay. C is the correct answer, no doubt in this, all of you. It is supposititious child, also known as fictitious child. Woman pretends the pregnancy and presents with a child. So, and this can be confirmed by DNA fingerprinting. Okay, so this can be solved by DNA fingerprinting. DNA. So by DNA fingerprinting, by looking at the VNTR, variable number tandem repeats present in the introns, you can identify who is the actual father is. Whether is a neighbor or some other person, that can be identified with the help of DNA fingerprinting. It was invented by Alec Jeffrey. That is also a question. What is superfecundation? Anyone can you guess? Anyone can you guess superfecundation? This is very interesting case. Superfecundation. In superfecundation, there is a fertilization of two ova. Fertilization of two ova released at the same time from both the ovaries. So two ova, they are fertilized and they are released at the same time. So that is known as superfecundation. Either it can be homopaternal fecundation, homopaternal, or it can be heteropaternal. Okay, heteropaternal fecundation. Heteropaternal. That means hetero means different fathers. So one belongs to the husband, one belongs to some other male. There can be a chances of illegal relationship. That can be a case of adultery. So that is superfecundation. The fertilization of two ova released. So they are fertilized during the same cycle. So that is known as superfecundation. Yes, Saurabh Nikam. So VNTR means variable number tandem repeat. That is the principle of DNA fingerprint. Look at this, superfecundation. fertilization of two ova which have been discharged from the ovary at the same period by two separate acts of the coitus committed at short interval. Okay. And this is the onset of twins. How common is superfecundation? Two fathers. Okay. Two fathers. That is the very interesting question asked in your exam. Can be that is homopaternal or heteropaternal superfecundation. This is superfecundation. Yes, my dear student, any doubt in this? Any doubt in this superfecundation? Yeah. Then what is superfetation? What is superfetation? Yes, what is superfetation, my dear student? What is superfetation? Come on, Saurabh, Nikram, Gosul Ajam, Mohammad Rahman. Yes, come on. What is superfetation? Superfetation means fertilization of second ovum in a woman who is already pregnant. A different cycle. That is known as superfetation. So there can be at least 4 to 5 weeks gap between, age gap between the first fetus and the second fetus which is fertilized. That is known as superfetation. The question can be asked, what is posthumous child? Posthumous child, so when child born or the fetus born after the death of the father within 280 days, known as posthumous child. Child born after death of its father, the mother being consumed by said father, that is known as posthumous child. The 4 definition can be asked in the exam. Superfecundation, superfetation, supposititious child, and posthumous child. All the 4 can be asked in your exam. Okay? Yes. So what is fecundation ab extra? That is also can be asked in your exam. Fecundation ab extra. So homework for you. What is fecundation ab extra? For those who are watching this video, please answer this question. Write it in the chat box. Write it in the comment box also. What is fecundation ab extra? Homework for you. Okay. Just find it out. Fecundation ab extra. Okay. Next question. Yes. So go through this question. Try to answer this question 34. This is the question asked about the age of the fetus by looking at the length, crown rump length. Rule of Hussey is used here. Rule of Morrison. This question is about rule of Hussey. Rule of Hussey. Okay. Rule of Hussey. So here the weight is 45 grams. So it is difficult to remember in terms of weight. Length is very easy. Length is 25. So length is 25. So up to 5 months. Up to 5 months. Okay. And more than 5 months. More than 5 months. This is what you must know. So up to 5 months, it is the square root of length. Square root of length. After 5 months, length divided by 5. Now this is nothing but rule of Hussey. So 25 is given. Square root of 25 is equal to 5 months. 5 months is the correct answer. Answer for this question is 5 months correct answer. Okay, 5 months. Rule of Hussey. Look at this rule of Hussey. So it is in terms of lunar month. In terms of lunar month. So 3 months it is 9 centimeter. 4 months 16 centimeter. 5 months 25. After that 6 into 5. Our length divided by 5. That is 30, 35, 40, 45, 50. CRL means crown rump length. So the month in terms of lunar month, 28 days cycle. So this can be asked in your exam. This is known as rule of Hussey. Anybody in the class? What do you mean by viability? What do you mean by viability in India? What do you mean by viability in India? Yes, FMGE student, it is a basic question. So when you call the fetus is viable, at what age of intrauterine life The fetus is called as viable child. Can you guess? And what is the center for that? What is the center which appears at that age? Viability means 28 weeks. 28 weeks. The center is thallus. Okay, center is thallus. My dear student, the question can be asked. So full-term baby, the marker or the ossification center appears at 9 months. That should be lower end of the femur. The lower end of the femur that appears at the 9 month. Thallus appears at the month of 7 month, 28 weeks. So this can be asked in your exam. Okay. Female died after 4 years of marriage. There was a note from her mentioning that she was tortured or dowry. It's a case of dowry death. Inquest in this case done by. Yes, my dear student. So here a case of dowry death. Inquest means inquiry towards the cause of death. Inquest in India can be two types: police inquest, magistrate inquest. Again, magistrate inquest can be executive magistrate, judicial magistrate. The question is, inquest in this case done by. Yes, what is the answer? What is the answer for this question? Yes, it is not the police. It is not the police constable, not by the doctor. It must be magistrate. Magistrate, it comes under CRPC. Let you know this question can be asked. So this is 176 CRPC. 176 CRPC. Again, 170 CRPC divided into 176 1 and 176 1A also. 1 means executive magistrate. 176 1A judicial magistrate. That is not required. So if you want, you can remember, in case of dowry death, inquest is conducted by the magistrate, executive magistrate. So that is the correct answer. And dowry death is punishable under 304B. Anyone in the class? Domestic violence is punishable under dash IPC. Domestic violence. Anyone, can you guess? Domestic violence. Domestic violence is punishable under dash IPC. Anyone, can you guess? Anyone? Yes. Come on. Domestic violence, also known as wife battery syndrome, or wife beating syndrome, that is punishable under 498A. Okay, 498A IPC. 498A IPC, that is wife battery syndrome, wife beating syndrome, domestic violence. That is, yes. Okay. Can you name one very famous cricketer? So under this section 498A recently, now he's on bail. And can you name that cricketer? Can you name that cricketer? Who is that famous cricketer who is into this trouble of domestic violence by the wife? Okay, very famous cricketer. Yes, can you try this? Saurabh Nikam, Abdullah, Abdul Wasim, Gosul, Ajam, Hiranna. Yes, come on. Yes, Saurabh Nikam. Come on. Yes. Who is that? Who is that cricketer? Yes, my dear students. Are you okay, my dear students? Yeah. Yes, okay. So the answer is Dinesh Karthik. No, not Dinesh Karthik. He is not Dinesh Karthik. Mohammed Shami. Mohammed Shami is the one who is into this trouble. So question number 36. In a case of RTA, dead body showed some spasm of group of muscle. So spasm of group of muscle, it must be a case of cadaveric spasm, catalytic rigidity. Which of the following condition primary relaxation is not seen? This is the very tricky question. Primary relaxation, you know, all of you. So yes, you are right. Shikhar Dhawan also. Shikhar Dhawan also, correct. Saurabh Nikam. So you know what happens whenever there is a cadaveric spasm. So there is no primary relaxation of the. Answer for this question is cadaveric spasm. Okay. So what happens After death, all the muscle undergo relaxation. That is known as primary relaxation. At death, what happens? All the muscle undergo primary relaxation. Okay, primary relaxation. All the muscle they undergo primary relaxation. There will be jaw drooping. There will be relaxation of all the muscles, voluntary muscle, involuntary muscle. So because of relaxation, there can be sphincter, can be urination, or there can be defecation also after death because of sphincter relaxation after death. So PR. So then all the muscle they undergo rigor mortis. All the muscle undergo stiffening. Is known as rigor mortis. Then this all the muscle after that undergo secondary relaxation. So primary relaxation, rigor mortis, secondary relaxation. This can be asked in our exam. This primary relaxation is absent in case of cadaveric spasm. Okay? Cadaveric spasm, primary relaxation is absent. This is what asked in the exam. So look at this. So this is a case of cadaveric spasm. You can see here. So there is some contraction of the muscle. So that is especially the voluntary muscle of the upper limb. So this is known as cadaveric spasm. This is cadaveric spasm. Okay. This cadaveric spasm. My dear student, is it antemortem or postmortem? Is it antemortem or postmortem? Yes. Is it antemortem or is it postmortem? Yes, it is purely antemortem we discussed. This question, very nice question, my dear students. A person has developed symptoms identical to those seen in the bite of scorpion with the stone. Scorpion bite. You must know what are the signs and symptoms of scorpion bite. Anyone? What is the finding in scorpion bite? What is the finding in scorpion bite? So this is a scorpion. So this is a scorpion, and the very important finding, the very important finding will be the pain. Extreme degree of pain. Pain will be there. Extreme degree of pain that is seen in case of scorpion bite. And scorpion venom act on the adrenals that causes release of catecholamines. So they cause release of adrenaline, noradrenaline. That leads to increased heart rate, increased respiratory rate, increased blood pressure. There can be nausea, vomiting, headache. All these are possible in case of scorpion bite. So the venom of the scorpion that is more dangerous than snake venom, but the amount injected is very small. That's why the death is very rare. That's why we give treatment prazosin. Prazosin. Beta, what is prazosin? What is prazosin, beta? What is prazosin? What is prazosin? Sauramnicol, gosolajam. What is prazosin? So prazosin, it is the antagonist, that is the alpha adrenergic agonist, I think. So it inhibits the release of catecholamines. It is the physiological antidote for the scorpion bite. The question is, the person presents with the features of scorpion. Which of the following has the same signs and symptoms? Caterpillar, no. Tick bite, no. Sea urchin, no. Spider bite. According to standard textbook, is the spider. So the spider is the one which presents with the same signs and scorpion. Let's discuss about spider bites at some point. Okay. So this is the spider. Okay. So this is the poisonous spider. So that is known as black widow, black spider, brown recluse spider, can be poisonous. It is present or prevalent in Australia and America, not in India. So what are the signs and symptoms? The signs and symptoms can be severe pain, diaphoresis, can be priapism, neurotoxicity. So all the signs and symptoms, so they are confused with a scorpion bite. So they act on the glutamate and acetylcholine receptor. So they cause necrosis, pulmonary edema, and pyrexia. This is the rare question asked. So they are not very commonly asked, my dear student. So it is a rare question asked. Try to memorize. Sharpened bite presents with the pain. The antidote is prazosin. Now, now the question is about Delhi crime. Okay, the question is about Delhi crime. So Delhi crime. Have you watched the Delhi crime, my dear students? Netflix series Delhi crime related to Nirbhaya case of rape and murder. A very nice web series, and there are so many things related to forensic medicine in that. One of that is the dying declaration. What do you mean by dying declaration? Dying declaration is the declaration by dying person. Okay, so that can be recorded by doctor, magistrate, or it can be police also, village head also. Any person can record a dying. So it is the oral evidence. It's oral evidence. Sometimes we can record by phone also. It can be recorded video, audio also, or it can be written statement also. Anything that can be dying declaration related to the circumstances of the death. Okay. The question is, when victim is dying because of unlawful act, police recorded dying declaration. Doctor certifies that victim was conscious, mentally oriented. That is nothing but composement is positive. So composement is positive. Under what circumstances dying declaration is invalid? Invalid. You guess, my dear student? Under what circumstances dying declaration is invalid? So dying declaration taken by the magistrate or dying declaration taken by any person, that becomes invalid in what condition? When person survives. When declarant survives, so it is of no value or invalid. It has no value in court of law. It acts as a only corroborative evidence. So the correct answer is victim is not dead. That is the correct answer. Victim did not sign the declaration. Yes. So that can be some circumstance where victim dies soon before taking the signature. Yes, that is not the answer. Declarant is expecting death. Done by doctor. Yes, it can be done by doctor. That is also a dying declaration. But when it is recorded by a magistrate, it has more value than any other dying declaration recorded by doctor or some other person. Okay, so this can be asked in the exam. Okay, fine, fine. Okay, yes, from okay, serotonin is back. Beta serotonin, welcome back. Saurabh Nikam, welcome back. Yes, yes, come on, come on. We are into the serious case of Delhi crime. So serotonin. So answer is this is the A is the correct. Okay. So my dear student, so what do you mean by dying deposition? What do you mean by dying deposition? What do you mean by dying deposition? Anyone can you guess? What do you mean by dying deposition? The dying deposition is not there in India. We have only dying declaration. Dying deposition is statement of the victim in presence of accused and accused lawyer or the accused advocate is known as dying deposition. Okay, it is also known as bedside court. Bedside court. Bedside court or bedside court. That is the correct answer. Dying deposition is not prevalent in India. Statement of the victim in front or in presence of the accused or the advocate of the accused is known as dying deposition, which is not prevalent in India. We have only dying declaration. Okay. Yes. Come on. Yes, my dear student, one more question. What about the oath? Is it taken in case of dying declaration? Oath, is it taken? Oath. Oath. Oath, Shapath. Whether Shapath is taken in case of dying declaration or not. What do you think? What do you think, my dear student? What do you think? Oath is taken in dying declaration or not? Yes, oath. The oath is not taken during statement of dying declaration. That can be asked. And there is no cross examination of dying declaration. Because anyway, the person is died. So we have a belief that dying person going to tell the truth. So that's why no cross examination, no oath in case of dying declaration. And this is what you must. Next, identify the type of fingerprint. Now we are into the fingerprint. Look at the fingerprint. So the fingerprint looks like this. Print looks like this. What is this fingerprint? What is this fingerprint known as? You can see the entry point and exit point on the same side. Enter and exit on the same side. The same side. And you have one core and one delta. One core and one delta. Okay, one core and one delta. The core means curving ridge. Delta means three directional meeting point. So whenever you see one core and one delta, entry exit point on the same side, it must be yes, yes, yes. That is the loop is the correct answer. So the answer is loop is the correct answer. So arch will look like this. Okay? Arch will look like this is arch. Oval, how it looks like. So this is oval. Composite is mixed. The composite is mixed. Answer is this is the entry and exit point on the same side. It must be loop is the correct answer. Look at this. Now we can clearly visible. What is this? ABC. Can identify? ABC can identify this. ABC. ABC can identify. ABC. Come on. A is arch. A is arch. B, that is loop. C, that is the hole. C, that is the hole. So this is how you need to identify. Remember, fingerprint is also known as a dactylography. Okay. Dactylography, fingerprint system. Fingerprint can be absent in case of leprosy, radiation injury, electrical injury. So fingerprint is a very commonly asked topic. You must know in and out of the fingerprint. Dead body with a wound on the neck with a clean cut margins. Clean cut margins. Margins are clean cut. Yes, you are right. Avinash Yadav, you are right. So it is the loop. Yeah, you are right. Beta, very good. Avinash Yadav, beta, very good. Good answer. Okay. And Saurabh Nikam, hold my serotonin. Okay. So composite means mixed beta. Composite is mixed other than the basic arch. Abdullah and Abdul was saying composite means mixed. Composite means joined, that is mixed. When it contains more than two types other than the basic arch is known as composite. That is the least common type. Most common is the loop, the least common is the composite. It is known as dactylography. It can be used even in identical twins. Okay, so most of your mobile applications, fingerprint scan and all, it's very common application because it is very specific to a particular person. Okay, next. So dead body, clean cut edges. Clean cut edges are there. Clean cut. Clean cut, whenever clean cut is there, it is incised wound. Incised. Crushed margins. Crush is there. Crushed. Whenever word crush is there, it must be laceration. Must be laceration. So there is a feature of incised wound and a laceration. What is the answer? Can you guess? What is the answer? It is not avulsion laceration. Avulsion nahi hoga beta. Avulsion is a laceration where you will see the flaying, degloving you will see. But here the question is clean cut edges with crushed margins also. Laceration, definitely no. Incised wound, no. Answer is chop wound is the correct. Chop wound, you will see the features of incised wound as well as the features of the laceration. One more very important finding in chop wound is deep gaping wounds. Deep gaping. Okay. Deep gaping wounds. Deep gaping wounds. Deep gaping, that is a feature of chop wound. And it is usually caused by the axe. Now, axe is the one that is commonly used. Avulsion laceration, not the answer. Answer is chop wound is the correct answer. Dear student, It's little tricky question. It is difficult question. So the question answer is chop wound. When clean cut margin given, only clean cut margin incised wound. When there is a clean cut margin along with the crushed tissues are there, crush is there, must be some heavy weight weapon. So the weapon which is having heavy weight must be an axe. So that is the chop wound is the correct answer. Deep gaping is the characteristic feature. Now, okay. Next question. A 14-year-old girl was kidnapped by a male. While the police arrested him, he died in the police custody. The inquest conducted by. So it is a case of lock-up death. So in lock-up death, it must be judicial magistrate. Very simple. The judicial magistrate comes under 176 CRPC. 176 CRPC we discussed already. It is an indication for magistrate inquest. It is a lock-up death. Now look at this question. I think yesterday question. Yes. Fine. A man was admitted in a casualty with the following sign. The sign is the ptosis. When you can see the eye of the patient, you can see the ptosis. Beta Saurabh Bhatia, thank you Saurabh Bhatia. So and serotonin, yes, yes, beta, yes, Abdul Wasim, thank you for your compliments. Yes, thank you. Now let's complete some more questions, and next half an hour I'm going to complete all the questions which is given in your PDF. Okay, now you can see here there is a snake bite. You can see the ptosis. And the patient died during respiratory paralysis. What is the cause of death? So this is the common crate. Okay, the snake which is given here is the common crate. Today we discussed in detail about the snake. A common crate is also known as Bungaru ceruleus, one of the most fatal snake. Signs and symptoms resemble like stroke, and the finding here is the ptosis. So it must be neurotoxic snake bite. Neurotoxic means Elapidae. Elapidae that consists of common cobra, king cobra, common crate. So all these Elapidae, they cause respiratory paralysis. What is the best answer? The best answer is respiratory paralysis. So if the viper is given, your answer should be that is the bleeding manifestation in case of vipers. Okay. Renal failure, especially in case of Russell viper. Coagulopathy is also viper. Shock is also viper. Shock, renal failure, coagulopathy, they are seen in Russell's viper, star-scaled viper, picked viper, hump-nosed viper. So your answer should be that is the Elapidae respiratory paralysis. Okay. Fine. Now question number 43. This is about the fetal autopsy. The question is about the fetal autopsy. In autopsy, doctor tried bronchus and checking the floating and sinking of the lung. So the lung was dissected, so it was kept in the water. So and he was looking at whether it is floating or whether it is sinking. So what is this test known as? So here doctor is trying to differentiate between stillbirth and the live birth. Okay. He is trying to differentiate between stillbirth and the live birth. So based on the specific gravity of the lung. So in stillbirth, what happens? Lungs are not active. There is no active respiration. That's why the lungs, they sink. In case of live birth, lungs, there is air in the lungs, so it can float. Here, So when lung float, that means it is live birth. When lungs sink, so it must be a stillbirth. This test is known as hydrostatic test. Answer for this question is hydrostatic test, also known as rigor test. Rigor test. So rigor test. So my dear student, so all of you write this point. Hydrostatic test is known as rigor test. Rigor test. Gosulasm. So Gosulasm, beta, thank you. So thank you for, okay sir, I am your going for the best. Okay, fine. Yes, okay. Good. So my dear students, so the answer for this question is hydrostatic test, also known as rigor test. Rigor test based on the principle that specific gravity. The specific gravity of air, water, and the lung we discuss next slide. Answer for this question is, that is the rigor test. What is Gettler test? Gettler test that is used in case of drowning. Is used in case of drowning. It is based on the chloride concentration present in left and right ventricle of the heart. So Gettler test is not the answer. Diatom test. So diatom test is also for the drowning. So when diatoms are there in the brain and the bone marrow, that is the feature of antemortem drowning. So it is not diatom test, it is not Gettler test. Floquet test. The Floquet test, in Floquet test, my dear student, in Floquet test, we take the ratio between lung weight and the body weight. Lung weight and the body weight. So in case of unrespired lung, it is 1/70. In case of respired lung, it is 1/35. So remember, my dear student, Gettler test based on the chloride concentration useful in drowning. Diatom test is also useful in drowning. Hydrostatic test is a specific gravity test used in case of stillbirth and live birth. Floquet test, it is the proportional ratio where we compare lung weight with the body weight. If the ratio is 1:70, then it is the stillbirth. If it is 1/35, it must be live birth. This can be asked in your exam. Look at this. Now look at this hydrostatic test. Now come back to the hydrostatic test. So this is the hydrostatic test. Specific gravity respired lung is 940. Unrespired lung, it is around 1040. Water is around 1000. So what you need to do, you need to dissect the lung during autopsy. Dissect the fetal lungs during autopsy. Put in the water. Place it in the water. If it sinks, unrespired lung. Okay. If it floats, then it is respired lung. If it floats, what you need to do? You need to take out the lung, cut into small pieces and squeeze. Cut into small pieces and squeeze, and again you place it in the water. So if it sinks, then it is the stillbirth. If it floats, then it is the live birth. Live birth in the sense, so lungs, so they are active. There is a lungs active, lungs are functional. That means they float. That is the meaning of that. So my homework, all of you, what do you mean by false positive and what do you mean by false negative? This can be asked in your exam. False negative test. So what is false positive and what is false negative in hydrostatic test? So those who are watching this video, at the end you just type the answer in the Google comments, okay, in the YouTube comments. Next, patient was brought to OPD. Patient was brought to OPD with a greenish color skin, rotten egg smell. The poisoning could be the rotten egg smell. So what is the answer, my dear student? What is the answer for this question? Rotten egg smell. Rotten egg smell. Yes, common. Rotten egg smell. Yes, my dear student, come back. Question number 44. We are into the last part. Next 20 minutes, I'm going to complete the class. So, patient was brought to OPD with a greenish color skin, greenish, green color, and the smell is rotten egg smell. So, this is the rotten egg smell. Transport and causes histotoxic hypoxia and death. The answer for this question is hydrogen sulfide. Some more smell that can be asked in the exam. Anyone can you guess? Garlic smell. Where it is seen? Garlic smell. Burnt rope smell. Where it can be seen? Withdrawal smell and drainage smell. You know, that is nothing but hydrogen sulfide. Anyone can you guess? Garlic smell. Yesterday we discussed garlic smell. Garlic smell is seen in arsenic and phosphorus. Arsenic and phosphorus. Yellow phosphorus. Okay. One trope, cannabis. Cannabis. Bitter almond. Anyone? Bitter almond, where it is seen? Bitter almond smell. Okay. So it is a sex-linked recessive trait. The bitter almond smell that is seen in case of cyanide poison. Cyanide poison. Cyanide poison. So drainage gas smell, nothing but that is the hydrogen sulfide. Hydrogen sulfide that we discussed, rotten egg smell, and drainage gas. So now, so these are 4 MCQ. These all are one-liner that can be asked in the exam. Acrid smell. Let's see now who is going to answer. Acrid, unpleasant, acrid smell. Where it can be seen? Anyone can you guess? Acrid smell. Acrid smell. Come on, try. Acrid smell. The student, acrid smell. Acrid smell. Acrid. Acrid smell. Where it is seen? Acrid. Come on, try acrid smell. Acrid smell is seen in case of paraldehyde. Paraldehyde smell. In paraldehyde poison, the smell will be acrid smell. Good. Now, this is a very interesting question, my dear student. We are into the last part of the discussion. So, my dear student, come back to the now sexual perversion. A man continues to call females. This is a common thing. But what is wrong here? Man continues to call females. He is calling random female, some unknown female. He is not calling his girlfriend. He is calling his some random female, some random number is calling. Achieve sexual gratification. He will get sexual gratification by talking or by sharing some obscene pictures. So he gets some pleasure by doing that. So there is no intercourse, but he'll get a sexual pleasure by doing this nonsense. What is this known as? Anyone can you guess? Anyone can you guess what is the answer for this question? So this is known as catalogia. Catalogia. Satyriasis we discussed. So that is excessive sexual desire in male. Stalking. What do you mean by stalking? What do you mean by stalking? Stalking means पीछा करना, follow करना. So following a female by a male with a clear indication of disinterest, who are sending messages, WhatsApp messages, text messages, telegram messages to a female with a clear indication of disinterest. So that is known as stalking. Stalking is punishable under 354. 354C IPC, 354D IPC, 354D. D, that is the stalking. Voyeurism already we discussed today. Voyeurism is peeping tom, that is observing a female while changing the dress, taking the image, capturing image. That is known as voyeurism. Answer for this question is not voyeurism, not stalking, satyriasis. It is scatologia, correct answer. Catalogia is a correct answer. Okay, now look at this. My dear student, I'm giving you some interesting image that just to just to make the forensic medicine interesting. There is a nice movie in Bollywood. Also, it is a remake of some Malayalam movie. It is dubbed in Kannada also, Telugu also, Tamil also. The name of the movie is Drishyam. I've seen this movie. in this movie, what the villain will do? The villain will capture the image, the video of the private act of the girl. That is the basis of the entire movie. What is this sexual perversion known as? Anyone? Anyone? What is that known as? Yes. So this sexual perversion, so that is related to this movie is voyeurism. Voyeurism, and voyeurism is punishable under. Anyone can you guess? Voyeurism is punishable under. Yes, you are right, Mr. Serotonin. 354C is the correct answer. 354C is the correct answer for this question. So 354C, that is voyeurism, also known as peeping Tom. Talking, 354D. Okay. So 354A also can be asked. 354A, 354B, and C and D also. So 354A, that is sexual harassment. They said sexual harassment is 354A. 354B related to the cloth, tearing cloth, removing the cloth of the female. So that is 354. Disrobing men, disrobing female, that is 354B. T, that is voyeurism, and D, that is stalking. D, that is stalking, is the okay. So this is what you must know. There are 4 IPCs related to 354. 354 A, B, C, D. A for sexual harassment, B for disrobing female, C for voyeurism, D for stalking. Now some sexual perversions. Now I am going to give you some perversion. So you need to identify what is the answer for that. Okay. Yes, come on, ready all of you? My dear student, are you ready? Are you ready? Ready for the extra sexual perversion, sexual paraphilia? Yes. Yes, come on, come on, come on. Yes. So here is the sexual perversion where the person gets sexual pleasure by beating the partner. By beating the partner, by hurting the partner, he gets the sexual pleasure. What is this known as? Guess anyone? Anyone? What is this known as? Come on, come on. It is in forensic, medicine. Chapter is the sexual perversion. What is this known as? Come on, try all of you. Yes. So this is known as sadism. This is known as sadism. Sometimes the sadism is associated with lust murder. Sometimes it is associated with necrophilia, necrophagia also. So having intercourse with the dead is known as necrophilia. Eating dead person, that is a dead person's body parts, that is known as necrophilia, necrophagia. This is very important question. Some people, they get sexual pleasure by taking the pain. By taking the pain, what is that known as? That is known as masochism. Masochism. Okay, masochism. Sometimes both this sadism and masochism, they occur together. That is known as bondage. That can be asked in your exam. What is bondage? Bondage means combination of sadism and masochism. Good. So, next, look at this. So this is already we discussed. 354C we discussed. No need to discuss about again. Voyeurism. Look at this. This is the necrophilia, necrophagia. That is 297 IPC. 297 IPC. One more here. Look at this. Look at this image. What is this image? Anyone can you guess? Anyone can you guess? Anyone can you guess? Anyone can you guess where a male, usually a male, so he gets the sexual pleasure, a sexual gratification by rubbing his private parts against the female body part. It is common in crowded places, buses, metro trains. What is this known as? Anyone can you guess? What is this known as? It is known as chikan in Japan. What is this sexual perversion of rubbing genitals is known as? Anyone, can you guess? Let's see who is going to answer this. Who is going to answer this, and what is the IPC for that? Yes, so you are right, serotonin. So this is known as proteinurism. Proteinurism is the correct answer, and it is punishable under 290 IPC. 290, this can be asked in your exam. So 290, 297, 300, 302, 304B, all these are very commonly asked FMGE questions. Yeah, proteinurism, that is the correct. Good. Now, identify this type of abuse. Identify this type of abuse. So what you can see here, four options. Snorting, hookah, puffing, chasing the dragon. I think this you can try, my dear student. My dear student, what is this? What is this? Come on, try this. Yes, come on, try. Try. Okay, yes. Saurabh Nikam, beta. Yes, come on. What is this? So what is here? You can see here some flames. Some flame you can see here. And this is the drug. So this is the drug which was heated from the below. So it was heated from the below and inhaling that devil, inhaling that fumes. So what is that known as? Yes, all of you. So this is known as chasing the dragon. Chasing the dragon is the correct answer for this question. So this is the chasing the dragon. So a the metal plate or some paper is placed. Above that, the drug is placed, and it is heated from the below. And the person is trying to inhale the fumes. That looks like a devil. So that is known as chasing the dragon. Snorting, as you know, snorting means nasal. That is especially in case of cocaine. Cocaine, that we'll discuss later. Hookah, that is actually smoking purpose. Smoke purpose, especially the ganja. Puffing, that is a bag containing the liquid of the drug or the some agent, that is known as hoofing. Let's see now. Look at this three. Identify this. Yes, chasing the dragon for heroin. You are right. Serotonin. You are right. Chasing the dragon for heroin. Look at this. There are three are there. I think you can identify this very easily now. So what is this A? What is this B? And what is this C? This is very easy. This is very easy thing. Very easy. Yes, very easy, my dear students. My dear students, can you try? Try this. What is this A and B, C? A, B, C. A, that is very simple. So this is the snorting. A is nothing but snorting. A is snorting. So snorting in case of cocaine. Cocaine. Any drug. To this heroin also. B, that is hook. So B, that is, this is hookah. Hookah. This is nothing but puffing. Okay. So these are three. There are four, I think. Hoofing and snorting and hookah, and also one more is that is chasing the dragon we discussed. So this question asked in FMGE exam. FMGE exam. Next. IPC for causing abortion without women's consent. Now the question is about criminal abortion. So IPC for causing abortion without women's consent. The criminal abortion, CAB. Criminal abortion, CAB. So when abortion is conducted by some criminal methods, by using example calotropes, semicarpus anacardium, so which causes serious complication and death of the female also. So criminal abortion, how to remember, let you know. CAB is there, no? CAB, C for third alphabet, A12. So 312 IPC, so that is for criminal abortion. So 312 IPC, that is for criminal abortion with consent. Okay. With consent. What is 312 IPC? So 312 IPC is the criminal abortion with the consent of the mother. 312. What is 313? 313 is criminal abortion without consent. Without consent. That is 313. What is 314? So 314, when there is a death of the female. When there is a death of the female, so because of criminal abortion with or without consent, that is known as 314. So my dear student, 312, 313, 314, all these are asked in the exam. 312 with the consent, 313 without the consent, death of the mother, 314 IPC. So answer for this question will be 313 is the correct. So okay. 320, that is the grievous hurt. What is 320? Grievous hurt. So 320 is grievous hurt, 325 is the punishment for grievous hurt. So 47 who answered? Yes, serotonin, you are right. Saurabh Nikam, you are right. So very nice, very nice. Okay. Inhaling the cloth soaked in drug. Can be plastic or the clothes soaked in drug. Already we discussed this. Hoofing. Hookah, not snorting, not chasing dragon. It is the hoofing, correct answer. 49. Ground for divorce. My next question, my dear student. So, my dear student, ground of divorce. Grounds of divorce. So, something very interesting now. My dear student, come back, my dear student. So, in what condition divorce can be taken by, or divorce can be asked from the wife or the husband? Option A, sterility, impotency at the time of marriage, oligospermia of the husband, poverty. What is the best answer? Yes, come on. Grounds of divorce. Come on, try this. Sterility, what do you think? If husband or wife sterile, when a wife is suffering from some PCOD or some condition involving the uterus, if she is sterile, so can he take the divorce from her? Or in the same way, oligospermia, zoospermia is there in the husband, can she apply for the divorce? Is it possible? What do you think, all of you? Yeah. So, ground for divorce, sterility is not the answer. Remember this. Sterility is not the answer. Sterility is not the ground, it is not the indication for divorce. Oligospermia of the husband, that is also not the answer. Oligospermia, azoospermia, a sterile husband is also not a ground for divorce. Poverty, definitely no. Definitely no. How poverty? Poverty is not the ground. So impotency at the time of marriage. Okay. Impotency. And impotency when husband is impotent at the time of marriage, when there is no sexual intercourse. So then according to Hindu Marriage Act, so it is the ground for divorce. Okay. So answer for this question is B is correct. Yes, B is correct answer. Good. Next, one of the victim of the fire, again it is about the dying declaration. So doctor was called as a part of the team to record the statement. The case of dying declaration. Which of the following is the role of the doctor? So the question is about what is the role of the doctor in case of dying declaration. So he can take a statement when magistrate is not there, if no one is there, he can take the dying declaration. But here, the basic function or the basic duty of the doctor is to give some report about the compos mentis. Okay. Answer for this question is compos mentis. So compos mentis means the orientation of the person towards the place, person, and the person, and the time. When a doctor states that the person is oriented to time, place, and person, he can give the statement That means it is compos mentis. The answer should be compos mentis is the correct answer. To record statement even in presence of magistrate, that is wrong statement. Magistrate has to take the statement, not the doctor. Cross-examine person, no. No cross-examination in dying declaration. Put person under oath before declaration. No oath is taken during dying declaration. The answer should be to assess compos mentis. Next. In case of death in lockup, inquest is held by. Inquest is held by. Yes, inquest is held by. Already we discussed. Is the magistrate correct answer. Lockup death we discussed. Again the same question. Rupture of the skin and subcutaneous tissue, that is known as tear in the skin. What it is known as? Option A, incised wound, abrasion, lacerated wound, contusion. It is not abrasion, because in abrasion there is no rupture of the subcutaneous tissue. So abrasion involves only the epidermis. Contusion, no. Answer should be lacerated wound. Okay. In lacerated wound is also known as tear. Okay. Lacerated wound is also known as tear. So the answer for this question, rupture of skin and subcutaneous tissue. So that is known as laceration. You will see the bridging of the tissue. So laceration can be owl's laceration, can be split laceration, stretch laceration, tear laceration, cut laceration. So in laceration, you will see bridging of the tissues. The answer for this question is laceration. In incised wound, you will see the clean cut margin. In abrasion involves only the epidermis. Bruise, there is a involvement of epidermis and dermis and a collection of blood in the subcutaneous tissue. There is no tear in the subcutaneous. The answer for this question is lacerated wound. Now let me ask you this question. My dear student, what is this? What is this, my dear student? What is this condition? Yes, come on. What is this condition? What is this condition? Try this question, my dear students. Here is the person who is suffering from borderline personality disorder. Person is having borderline personality disorder. He has multiple cuts, previous cuts. You can see the clean cut margins. The clean cut margins. Okay. What is this known as? What is this wound? Identify this. So here the person is suffering from. Yes, come on. Suffering from. Yes, come on. So this is the classical. What is this? Incised wound. Incised wound. Healed incised wound. Healed incised wound. You can see the clean cut margin, and they are nothing but hesitation cuts. Okay, hesitation cuts. Okay, so this can be asked in the exam. So he must be suffering from the borderline personality disorder, a histrionic personality disorder, or any previous history of attempt to suicide. So that is nothing but incised wound. In incised wound, you will see the clean cut mark. In laceration, you will see the bridging of the tissues. So my dear student, what is this known as? Look at this. What is this known as? What is this known as? Come on. What is this known as? Here is the knife. This is the knife. This is the knife you can see here. And he is the victim. So he is the victim. And the person is, protecting himself from the stab wound or incised wound. What is this injury known as? So what is this? Yes, injury known as. So, yes, come on. So this is known as defense wound. And defense wounds. Defense wounds. Defense wounds can be active, it can be passive. So here the classical picture showing active defense wound. So when it is present over the palmar surface of the hand or the web spaces of the hand, It must be active defense wound. That means the person is trying to grab the weapon. That is known as the active defense wound. When person try to protect himself, so he will do like this or like this. So then you will see the defense wounds over the dorsal aspect of the hand. That is known as passive defense wound. Okay, passive and active defense wound that can be asked in your FMGE. The time limit for ordering exhumation in India. The time limit for ordering exhumation in India. What do you think? So exhumation means digging out of dead body from the grave. Okay, so this is exhumation. Exhumation. So exhumation. So this is exhumation. So exhumation, it is digging out of dead body from the grave. Okay, so exhumation is digging out of the dead body from the grave. So time limit for exhumation in India. What is the time limit? So the time limit, so it is not 1 year, it is not 10 years. There is no time limit in India. There is no time limit in India. Exhumation can be done even after 10 years or 20 years or 30 years after the burial of the dead body. There is no time limit in India. And remember, in exhumation, we need requisition from magistrate. It is the indication for magistrate inquest. It comes under 176 CRPC. Comes under what? 176 CRPC. The question can be asked in the exam. 174 CRPC, police inquest. 176 CRPC, magistrate inquest. In case of exhumation, you need to preserve the soil sample to rule out the heavy metal poison in that area. So that is also asked in the exam. And it should be started during early morning time. Early morning time. Fine. Look at this, my dear students. My dear students, what are these? What are these A and B? What are these A and B during exhumation? Can you just let me know what is this A and B? Yes, come on, beta. Yes, come on. What is this A and B here? You can see the 4 bottles here, and 8 bottles are there. What are these 8 bottles, and what is the function of this? Saurabh Nikam, sir, can you add more pictures so we can remember more easily? Okay. Yes, come on. Yes, come on. Yes. Right. Yeah. We are into the last part. What is this? What is this known as? Come on. Yes. What is this known as A and B? But A and B, what are these? A and B, what are these in exhumation? What are these in exhumation? Come on. These two are, what are these two? Yeah. So they are nothing but soil sample. Okay. Soil sample. Very simple question. They are the soil samples are to be preserved in case of exhumation. Okay. And no disinfectant should be used. No disinfectant. No disinfectant should be used. Gettler test is positive in. As we discussed already, Gettler test is useful in drowning. It based on the chloride concentration in left and right ventricle. Your answer should be drowning is the correct. Drowning. Gettler test. Next. Superimposition technique is used for. Superimposition. Superimposition can be photo superimposition, video superimposition. So we compare skull along with the photo. What is this known as? Superimposition is very simple. Skull is the correct answer. Not the pelvis, not the femur, not the ribs. Answer is this is superimposition technique that is matching with the skull. Very simple it is. Now, a 40-year-old man has committed suicide by consuming some chemical he was able to procure from the paint making factory he works at. Doctor notices garlicky smell from the tissues, decided to preserve the hair for further investigation. Poisoning with which of the following require preservation of the hair? So it is a lengthy question, but it is very simple. The hair and cartilage, the hair and bones, so they are preserved in case of heavy metal poison. Case of heavy metal poison. So it is not the phosphorus, it is not the alcohol, so it is not a manganese. Your answer should be arsenic is the correct answer. Arsenic is the correct answer. So my dear student, arsenic is the correct answer. You are right. Saurabh Nikam, Medico Forever, Saurabh and others. So arsenic is known as king of all poison. It is one of the ideal homicidal agent. It can be mixed with any food and drink. It resembles like natural disease that is known as cholera. Okay, it can lead to black foot disease. It can lead to Aldrich Measline. It can lead to red velvety stomach. So it is ideal homicidal agent. The most common route is that is the water. Now some image based questions about the arsenic. Look at this now. Look at this. So this is one manifestation of arsenic poison. So arsenic, which causes gangrene of the foot because of the vasculitis of the blood vessel, and this is asked in FMGE exam. What is this condition caused by arsenic? What is this? Come on. What is this? Yes, my dear student. What is this caused by arsenic? You can see the gangrene of the limb. Gangrene of the limb. So this is known as black foot disease. Black foot disease. Black foot disease. So I'll discuss some 5 images. My dear student, I'll discuss 5 images. So all these are very commonly asked in FMG. So black foot disease caused by arsenic. The arsenic means arsenic trioxide. Arsenic trioxide is the one which causes black foot disease. Okay. Second image. Look at this. Look at this colorless, tasteless, odorless compound. So which is nothing but preparation of arsenic. So this is arsenic trioxide. Arsenic trioxide. So arsenic trioxide is a white color compound. It can be mixed with the food and drink. So it resembles like cholera. Can be asked in our exam. Okay, the question can be about the Chilis green also, Paris green also, the preparation of arsenic along with the copper. Now, image number 3. What is this? Anyone can you guess what is this 3? What is this image number 3? Image number 3, my dear student, you can see the some white color nail, white color line over the nail. So that is seen in case of arsenic poison also. That is also can be seen in thallium poison, that is asked in NEET PG exam. So this is a non-specific finding. Anyone can you guess? Yes, Saurabh and other students, my dear student, can you guess what is this? What is this? What is this known as? No, it is not white phosphorus. What is this? White phosphorus? Oh, yes, come on. We're discussing about the arsenic only, beta. 5 images in arsenic. Okay. So, yes, it is nothing but Aldrich Measline. Okay. Aldrich Measline. Aldrich Measline. Okay. Aldrich Measline. They are non-specific. That can be seen in thallium poison also. That can be seen in case of arsenic poison. Then this is the one very important finding that can be seen in case of arsenic poison. That's very commonly asked in the exam. So this is known as raindrop pigmentation. Raindrop pigmentation is seen in case of arsenic poison. Arsenic poison. You can see here all is a raindrop pigmentation. One more. So that is a red velvety stump. This can be asked in your exam. Red velvety red velvety stomach. Red velvety stomach is seen in case of acute arsenic poison. So all these are 5 images. All these are recent FMGE questions. So image number 1, black foot disease. 2, that is arsenic trioxide, colorless, tasteless compound. Aldrich measline can be seen in thallium poison. Raindrop pigmentation. Last one is red velvety stomach. Question number 16. Question number 16. Yes, come on. 16-year-old girl. So this is about the abortion, basically abortion. The question is about a doctor who will be eligible to perform abortion for this girl should have performed at least how many MTPs? Yes, my dear student. How many MTPs? So, anyone can you guess? Yes, Saurabh Mikam. Yes, come on. Yes, yes. It's not 10. It's 25. Okay. 25 is the correct answer. Minimum 25. Minimum 25. It is a fact-based question. Just remember, so he should assist at least 25, and out of 25, the MBBS doctor should do at least 5 independently. So that is the basic qualification to conduct the MTP according to MTP Act 1971. Which of the following condition gastric lavage is contraindicated? Okay, so this is the question. And which of the following gastric lavage is contraindicated? Yeah, come on. So organophosphate poison, sulfuric acid poison, datura poison, carbolic acid poison. So organophosphorus, not the answer. The organophosphorus compound, we do the gastric lavage. Datura poison, we do gastric lavage. Carbolic acid is a systemic acid. It causes hardening of the stomach, leathery stomach. You can do the gastric lavage. Answer should be sulfuric acid. Answer is sulfuric acid. Why sulfuric acid? Because, for example, this is the stomach. And this is the stomach. This is the stomach. So sulfuric acid causes multiple perforation. All these are perforation. So this is caused by sulfuric acid. So whenever in exam, multiple perforation of the stomach is caused by, your answer should be sulfuric acid. Sulfuric acid also causes black tongue. Black tongue. It also causes tacky white teeth. Tacky white teeth. And this can be asked in the exam. Even 5 to 10 ml can lead to death. Even 5 to 10 ml can lead to death. Carbolic acid, which causes hardening of the stomach, which is known as leathery stomach. So carbolic acid is an indication for gastric lavage. It is not a contraindication. So my dear students, so what is the preferred position of gastric lavage? What is the preferred position of gastric lavage? Anyone can you guess? What is the preferred position of gastric lavage? Preferred position of gastric lavage. Anyone can you guess? Your answer should be left lateral position. Left lateral position. Okay, left lateral position is the preferred position of gastric lavage. Gastric lavage contraindicated in corrosive poison, alkali and acid, except carbolic acid. Look at this. This is how gastric lavage, we do the measurement in children's like this. So how much Rile's tube or Eval's tube or Bo's tube that is required in gastric lavage. This is how they calculate tip of the nose and to the tragus, and from the tragus to the xiphisternum and the umbilicus. This is the length of the Rile's tube that should be passed to the stomach for the aspiration of the stomach contents. So we use activated charcoal. So we use saline also for the purpose of gastric lavage, and this gastric lavage is contraindicated in corrosive poison. Corrosive poison. Anyone in the class? Second gastric lavus. Second gastric lavus. Anyone? Can you guess in which condition we do second gastric lavus? Anyone can you guess? Second gastric lavus. Let's look at this. This is how we preserve the specimen of the stomach contents. That is mandatory according to 201 IPC. My question is second gastric lavus. In which condition second gastric lavus is done? Anyone can answer this question? Anyone? Second gastric lavus. Second gastric lavus. In which condition second gastric lavus is done? My dear students, Saurabh, beta, serotonin, yes, Saitana, okay, Saithama. So my dear Sapneshri, come on, answer this question. In which condition we do second gastric lavus after the first gastric lavus? Come on. Last part of the discussion. Yeah. So just find it out, the answer for that. Okay. Most reliable criteria of Gustafson method. We are into the last part. The most reliable criteria among the Gustafson criteria. Gustafson criteria is the criteria for age estimation. So the criteria for what? Age estimation. So it is used in adults after the age of 25 years. After the age of 25 years. 25 years. Yeah. Yeah. So options are root resorption, paradentosis, translucency of the root, attrition. Your answer should be translucency of the root. Answer will be translucency or transparency of the root. That is the most important criteria. So what is Gustafson method? Let me discuss about that. The Gustafson method is a method of age estimation. It is used in adults after the age of 25 years. There are 6 components are there. How many components? 6 components. So they can be remembered with the help of mnemonic script. The script is the mnemonic for the components of Gustafson method. So we use more anterior teeth for Gustafson method. What are 6 components? Starts with the S. What is S? Secondary dentin. Secondary dentin. So, example, this is the root cavity. This is the root cavity. Secondary dentin means deposition of calcium within the root cavity. This is known as secondary dentin. Secondary dentin is one of the important criteria of Gustafson method. You can say the second best criteria. Secondary dentin. The secondary dentin means the collection of the calcium within the root cavity. Again, it is graded as +1, +2, +3. Second criteria, C for cementum apposition. What is cementum apposition? Anyone? What is cementum apposition? Anyone? Yes, come on. Cementum apposition. What is cementum apposition? Cementum apposition. Come on, what is cementum apposition? Cementum opposition. Cementum opposition means as age advances, there will be more and more cement deposition around the teeth. That is characterized by incremental lines. So this is the incremental lines. They are visible in the teeth during microscopic examination. That is known as cementum opposition. Third, root resorption. Root resorption is the resorption of the bone of the teeth because of the function of osteoclast. Again, depending upon resorption, +1, +2, +3. Attrition. The attrition means wear and tear. Attrition means wear and tear as a result of mastication. What happens, all of you? Because of wear and tear, there can be loss of upper surface of the teeth. So that is known as attrition. Again, it is graded as +1, +2, +3. Periodontosis. Periodontosis means that is the loosening of the teeth. As age advances, so there can be more and more loosening of the teeth. That is known as periodontosis. Next, lastly, transference of the root. My dear student, bit difficult topic. Remember, Gustafson method. It is a method of age estimation by using teeth after the age of 25. There are six components are there. Mnemonic is script, secondary dentin, cementum apposition, root resorption, attrition, periodontosis, transference of the root. The best criteria, transference of root. Second best criteria, secondary dentin. This is Gustafson. Yeah. So that's it about the question number. Last question. So hope you understood all the important. Okay. So any doubt now you can ask me. Any doubt, my dear students? Doubt you can ask me. Yes, yes. Come on. Any doubt? Yes. Come on. Come on. Come on. Come on. Any doubt now? This is the last 5-10 minutes about that doubt. If you have any doubt, you can ask me. Yes. Come on. Yes, come on, my dear students. So we completed finally the second part of the forensic medicine. So yes, now it is a doubt session. So now I'm playing a video here. This is a very important topic. That is estimation of sex of the person by looking at the hip bone. It's a very, very commonly asked in the. Any doubt you can ask me? Any doubt? Yes, come on. Yeah, yeah. I'm just waiting for your queries. Queries. Come on. This is what we discussed in our classes. So that is about the sciatic notch. Sciatic notch is shallow and broad in case of females and deep and narrow in case of male. We discussed almost all the important topics along with the very nice images and the videos and revisions in between. So, and this is what the preauricular sulcus we discussed in our classes. Any doubt in this? Saurabh Nikam. Yes, any doubt in this? Yes, come on. Any doubt in this? Beta? Yes, come on. Any doubt? Yes, second gastric lavage. So serotonin, second gastric lavage, where it is done? It is done in case of opium poison, morphine poison. Okay, morphine poison. Thank you, Nikam. Thank you. With this now, so we'll end the class. So wish you all the best.